if you've been having joint pain for, I think you'd have to be hurting for at least 6 months before you'd seriously consider any type of surgery on one of your joints. But if it's a pain that won't go away, that is worse with activity, and x-rays show that it's due to arthritis, you'd start off with an exercise program, possibly an injection or some arthritis medication by mouth, assuming that that's safe to do. And if all of that doesn't work and you continue to have pain on a regular basis that limits your activities, then you may be a candidate for surgery. People decide to have surgery for joint replacement for 2 reasons. One, the pain is just so intense that they have to do something. And the second one is a little bit different. It's they can't do some of the activities that matter to them. They can't play with a grandchild. They can't go for a walk for exercise because their knee or hip bothers them so much. Sometimes it's they can't work, but frequently is they can't do normal activities outside of work. And hopefully with a successful surgery, they can get back to doing those activities that they want to do.